I'm about to show you specific non-drug methods that actually work to reverse hypertension after the age of 60. You might be tracking your numbers diligently, but if you are missing the underlying mechanical drivers of high pressure, those numbers may not move. I see this constantly in older adults who believe they have tried everything, only to discover that small, specific adjustments to their daily routine change everything. I remember a patient named Robert, a 72-year-old retired engineer, who came to me convinced his daily headaches were just part of getting older. He had been taking his blood pressure faithfully, but he was doing it at the wrong times and in the wrong posture, creating a cycle of anxiety and artificially high readings that didn't reflect his true health. When we corrected his measurement technique and addressed a simple potassium deficiency, his stubborn hypertension stabilized without adding more pills. This experience highlights a common issue where seniors are often prescribed more medication when what they actually need is a protocol that addresses arterial stiffness and nutrient balance. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes and should not be considered medical advice. I am not your personal physician and cannot provide individualized medical guidance through this video. Never stop, start, or change any blood pressure medication without first consulting with your doctor. 1. The resting protocol. Establish a strict 5-minute resting period in a seated position before you ever place the cuff on your arm or press the start button. This is not just about sitting down, it is about allowing your cardiovascular system to reach its true baseline so that you are not measuring stress or exertion. When you rush to the table or measure immediately after walking into a room, your sympathetic nervous system is still active, keeping your vessels slightly constricted and your heart rate elevated. By implementing a dedicated 5-minute window of absolute stillness, you allow the body to shift gears, giving you a reading that reflects your actual physiology rather than your momentary activity level. This simple pause is often the difference between a diagnosis of hypertension and a normal reading for your age group. This matters because accurate data is the foundation of any treatment plan, and false spikes often lead to unnecessary anxiety and over-medication. If your reading is artificially high because you did not rest, your doctor might increase your dosage based on a number that does not exist in your daily reality. I recall a patient named Martha, aged 68, who would measure her pressure immediately after her morning chores because she wanted to get it over with. Her readings were consistently in the danger zone until she started sitting in her chair for 5 minutes with a book before measuring. The drop in her systolic number was substantial, and it turned out her medication was working perfectly fine when measured correctly. The reason this protocol works lies in how gravity and muscle tension interact with your circulatory system when you are upright or active. When you move, your heart pumps harder to fight gravity and supply oxygen to your muscles, and this dynamic state takes time to settle down once you stop moving. Most seniors do not wait long enough for this settling process to complete, leading to what we call unstable baseline readings. By waiting 5 minutes, you allow the fluid shifts in your body to normalize and your heart rate to settle into a true resting rhythm. This removes the variable of physical exertion from the equation, leaving you with a raw number that tells the truth about your arterial stiffness and vascular health. To perform this correctly, sit in a chair with a supportive back, ensuring your feet are flat on the floor and uncrossed. Your arms should be resting on a table so that the cuff is at the same level as your heart, and your palms should be facing upward to relax the muscles in your arm. Close your eyes if it helps you relax, and breathe normally without talking, reading the news, or looking at your phone for 5 full minutes. Once the time is up, take your reading without moving your body unnecessarily, and if possible, take a second reading 1 minute later to confirm accuracy. Do not ignore the position of your feet or back, as unsupported legs or a slouched posture can raise your reading by several points. This ensures you are treating your actual blood pressure, not a momentary spike. 2. Isometric hand grip training. Perform isometric hand grip exercises 3 times a week to lower your resting blood pressure by training your blood vessels to dilate. This involves squeezing a resistance object like a towel roll or a hand gripper and holding that tension for a set duration without moving your joint. Unlike aerobic exercise like running or swimming, which involves repetitive movement, isometric exercise creates a sustained muscle contraction that compresses the blood vessels in your forearm. When you release the squeeze, blood rushes back into the vessels, triggering a massive release of nitric oxide that signals your arteries to relax and widen system-wide. This helps because it targets endothelial function, the ability of your inner blood vessel lining to manage pressure, without placing stress on your joints or requiring heavy cardio. It is an ideal intervention for seniors who may have limited mobility or arthritis but still need a powerful tool to manage hypertension. I treated a patient named Samuel, 75, who had severe knee osteoarthritis and felt helpless because he could not go for the long walks his previous doctor recommended. We introduced him to isometric hand grip training while he sat watching the evening news, and within 6 weeks his resting systolic pressure had dropped noticeably. He realized he could still actively lower his pressure even without high-impact movement. The mechanism here is purely physiological. The sustained squeeze creates a temporary localized environment of low oxygen in the muscle tissue. This slight stress signals the body that it needs to improve blood flow to that area, prompting a systemic adaptation that lowers resistance in your arteries even when you are not exercising. Recent studies suggest that this form of training can be as effective as a single blood pressure medication for some individuals because it directly improves the elasticity of the arterial walls. It is a mechanical signal that tells your body to prioritize vascular relaxation, counteracting the natural stiffening that happens as we age. To do this, use a spring-loaded hand gripper or a tightly rolled face towel that you can squeeze comfortably but firmly. Squeeze the object with one hand at about 30% of your maximum effort. This should feel like hard work but not painful or shaking strain, and hold it for exactly 2 minutes. After 2 minutes, rest for 1 minute, then switch to the other hand and repeat the process, aiming for a total of 4 2-minute squeezes, 2 on each hand. Do this routine 3 days a week, ensuring you have a rest day in between sessions to allow your vascular system to adapt. Avoid holding your breath while you squeeze, as this can temporarily spike your blood pressure. Keep breathing rhythmically throughout the exercise. This trains your arteries to remain open and flexible throughout the day. 3. The potassium-sodium inverse ratio. Prioritize eating high-potassium foods immediately before or during any meal that contains significant amounts of sodium. Instead of focusing solely on the difficult task of removing all salt from your diet, you should focus on adding potassium, which acts as a direct counterbalance to sodium in the body. Sodium and potassium operate like a seesaw in your kidneys. When potassium levels go up, your body is signaled to excrete more sodium through urine, lowering the fluid volume in your blood. Many seniors are not actually salt sensitive, but rather potassium deficient, meaning their body holds onto sodium simply because there isn't enough potassium to push it out. This matters because modern diets are often high in sodium and critically low in potassium, creating a chemical imbalance that forces your blood pressure up to maintain equilibrium. By correcting this ratio, you allow your kidneys to function closer to how they were designed, naturally regulating fluid balance without extreme deprivation. I worked with a patient named Eleanor, 71, who loved her Sunday family roasts and refused to eat bland, salt-free food, causing her great distress and social isolation. We shifted her focus to eating a large serving of steamed spinach or half an avocado before her main meal, and her pressure stabilized because she was finally giving her body the tool it needed to handle the sodium. The biological reason this works is that potassium relaxes the smooth muscle cells lining your arteries, reducing the resistance against which your heart must pump. Furthermore, higher potassium intake decreases the effects of salt on blood pressure, making your occasional salty meal less damaging to your overall numbers. It essentially buffers your system, providing a safety net that keeps your blood vessels pliable and prevents the water retention that bloats your volume and raises pressure. This is a strategy of addition rather than subtraction, which is often psychologically easier for seniors to maintain over the long term. To implement this, identify 3 or 4 high-potassium foods that you enjoy, such as avocados, sweet potatoes, cooked spinach, or bananas, if your sugar allows. Make it a rule to consume one of these items as the first part of your lunch and dinner, essentially preloading your system with potassium. For example, have a small spinach salad with olive oil before your main course, or choose a baked sweet potato as your side dish instead of rice or pasta. Ensure you are getting these nutrients from whole foods rather than supplements, as the absorption rate and safety profile are significantly better with real food. If you have kidney disease or are on specific medications that affect potassium levels, you must clear this dietary change with your doctor first. This restores the chemical balance required for relaxed blood vessels. Here is another simple dietary adjustment you can make. 4. Nitric oxide boosting via vegetables. Incorporate nitrate-rich vegetables into your daily diet to chemically stimulate the production of nitric oxide in your arteries. As we age, our bodies naturally produce less nitric oxide, a critical molecule that tells our blood vessels to widen and relax. This decline is a major reason why blood pressure tends to creep up over the age of 60, as the vessels become stiffer and less responsive to blood flow. By consuming dietary nitrates, you provide your body with the raw materials it needs to manufacture this gas through a secondary pathway involving the bacteria in your mouth and your stomach acid. This is important because it bypasses the aging pathways that are failing and uses digestion to deliver the medicine your arteries need directly. It is a powerful way to reduce arterial stiffness, which is the leading cause of isolated systolic hypertension in older adults. I recall a patient named James, 65, whose blood pressure remained stubborn despite medication, specifically his top number, which wouldn't drop below 150. He started eating a specific beet salad for lunch daily, and within a month, his systolic pressure dropped by 10 points, surprising even his cardiologist. The process begins when you chew these vegetables. Bacteria on your tongue convert the nitrates into nitrites, which are then swallowed and converted into nitric oxide in the gut and bloodstream. This nitric oxide enters the smooth muscle cells of the blood vessel walls, causing them to relax almost immediately, which widens the vessel diameter and lowers the pressure required to push blood through. It is essentially a natural vasodilator that works similarly to some blood pressure medications, but achieves the result through nutrition. This effect can last for several hours after a meal, providing a sustained reduction in pressure throughout the day. To do this effectively, focus on vegetables like beets, beetroot, arugula, rocket, spinach, and celery, which are the most potent sources of dietary nitrates. Try to include a serving of cooked beets or a fresh arugula salad with your lunch or dinner every single day to keep your nitric oxide levels consistently elevated. You can roast the beets in a batch for the week or blend them into a smoothie if you prefer, but avoid using strong antiseptic mouthwash immediately before or after eating them. Strong mouthwash kills the good bacteria on your tongue that are necessary for the first step of converting nitrates, rendering the vegetables far less effective. Be aware that eating significant amounts of beets may turn your urine or stool a pinkish color, which is harmless and normal. This naturally dilates your arteries to reduce the workload on your heart. 5. Post-meal gentle movement. Commit to a 10 to 15-minute gentle walk immediately after finishing your 2 largest meals of the day. This is not about cardio fitness or burning calories. It is about mechanically assisting your circulation during the digestion process. When you eat, a significant amount of blood is diverted to your stomach and intestines to aid in digestion, which can cause compensatory changes in your heart rate and vascular resistance. For seniors, sitting still immediately after a heavy meal can lead to blood pooling in the legs or a paradoxical spike in pressure as the body struggles to manage blood flow distribution. This is effective because the rhythmic contraction of your leg muscles acts as a second heart, pumping blood back up from your lower extremities and reducing the workload on your cardiovascular system. This is particularly crucial for avoiding postprandial hypertension, a spike in blood pressure after eating, which is a common but often overlooked issue in adults over 60. I remember a diabetic patient named Margaret, 74, who struggled with both erratic blood sugar and blood pressure spikes in the early afternoon. Once she started taking a slow, digestive stroll around her garden after lunch, both her glucose and her pressure readings leveled out significantly. effectively killing two birds with one stone. The mechanism relies on the fact that active muscles absorb glucose and improve blood flow efficiency without requiring the heart to pump harder. By walking at a slow, leisurely pace, what we often call Zone 1 effort, you encourage smooth circulation and prevent the stiffening effect that sitting causes in the arteries. This gentle activity signals your autonomic nervous system to stay balanced, preventing the stress response that often accompanies a large influx of calories and salt. It keeps the blood moving fluidly through your system, preventing the stagnation that increases pressure against arterial walls. To put this into practice, simply stand up and move within 20 minutes of your last bite of food. Do not clean the kitchen or sit down to watch TV first. Walk at a pace where you could easily sing a song or hold a full conversation without getting breathless. If you are sweating or panting, you are going too fast. You can walk around your living room, up and down your hallway, or outside if the weather permits, but keep it continuous for at least 10 minutes. If walking is difficult due to balance or pain, simple seated marching in place or gentle leg extensions can offer similar circulatory benefits. Do not turn this into a workout. The goal is relaxation and circulation, not raising your heart rate significantly. This simple habit prevents pressure spikes by mechanically assisting blood flow. Here is another technique you can use to calm your system instantly. 6. Slow-paced resonance breathing. Practice slow-paced breathing at a rate of 6 breaths or fewer per minute to directly activate your body's relaxation response. This technique, often called resonance frequency breathing, works by synchronizing your heart rate variability with your respiration, creating a physiological state where your cardiovascular system operates at maximum efficiency. Unlike normal breathing, which is often shallow and rapid, 12-18 breaths per minute, slowing your rate down sends a powerful signal via the vagus nerve to your brain to lower your heart rate and dilate your blood vessels. This is one of the few same-day levers you have to manually lower your blood pressure in real time during moments of stress. This matters because stress and anxiety are major drivers of transient hypertension, causing spikes that can last for hours and damage your vessels over time. Seniors often carry chronic low-level tension that keeps their sympathetic nervous system, the fight-or-flight mode, permanently switched on. I had a patient named Thomas, 70, who would see his pressure spike dangerously high whenever his grandchildren visited or when he had to deal with financial paperwork. By teaching him to use this breathing pattern for just a few minutes before these events, he was able to blunt that stress response and keep his numbers in a safe range. The science behind this is that slow, deep exhalations stimulate the parasympathetic nervous system, which is the rest and digest brake on your body's stress engine. When you breathe out slowly, you are physically forcing your body to relax, overriding the chemical signals of adrenaline and cortisol that constrict your arteries. It improves the baroreflex sensitivity, the mechanism your body uses to regulate blood pressure quickly, making your system more resilient to stress. This isn't just relaxation, it's a physiological hack that changes the chemical environment of your blood vessels within minutes. To do this, sit comfortably in a quiet place and inhale deeply through your nose for a count of 4 seconds, allowing your belly to expand. Then exhale slowly and smoothly through your mouth or nose for a count of 6 seconds, emptying your lungs completely. Repeat this cycle, 4 seconds in, 6 seconds out, for at least 5 minutes, focusing entirely on the rhythm and the feeling of the air moving. You can do this while watching TV, lying in bed before sleep, or even sitting in the car, making it a highly accessible tool for immediate control. If you feel lightheaded, stop immediately and return to your normal breathing pattern until you feel steady again. This manually switches off your stress response to lower pressure on demand. One more easy change you can try is optimizing your mineral intake. 7. Magnesium optimization. Increase your intake of magnesium-rich foods to help your blood vessels remain soft and pliable. Magnesium is often referred to as nature's physiological calcium channel blocker because it prevents calcium from rushing into heart and vessel cells, which causes them to contract and tighten. Many older adults are chronically deficient in magnesium due to lower dietary intake and reduced absorption efficiency in the gut as we age. Without sufficient magnesium, your arteries exist in a state of low-grade constriction, keeping your baseline blood pressure higher than it needs to be. This is critical because magnesium is essential for the structural health of your arteries and for regulating the electrical signals that keep your heart beating steadily. A deficiency here is like trying to drive a car with the parking brake slightly engaged. Your heart has to work harder to push blood through tight vessels. I remember a patient named Sarah, 66, who suffered from frequent leg cramps at night along with her high blood pressure, a classic sign of mineral imbalance. By adding a small daily serving of pumpkin seeds to her oatmeal, she not only resolved the cramps, but saw a modest yet consistent drop in her blood pressure readings over the following months. The mechanism is simple. Magnesium competes with calcium for entry into the smooth muscle cells of your vascular walls. When magnesium is present in adequate amounts, it blocks some of the calcium, allowing the muscle fibers to stay relaxed and the vessel to remain open. It also helps to regulate other minerals like sodium and potassium, acting as a master conductor for your electrolyte balance. This leads to a smoother, more relaxed vascular system that is less prone to spasms and stiffness. To improve your levels, incorporate a quarter cup of raw pumpkin seeds, pepitas, or almonds into your daily diet, as these are among the most dense natural sources of magnesium. You can sprinkle them on salads, mix them into yogurt, or simply eat them as a snack, ensuring they are unsalted to avoid adding unnecessary sodium. Dark leafy greens like spinach and Swiss chard are also excellent sources, so aim to have a green side dish with dinner several times a week. Avoid relying heavily on supplements unless prescribed, as some forms of magnesium pills can cause digestive upset in seniors. Food sources are gentler and better absorbed. Be careful with nuts and seeds if you have diverticulitis or difficulty chewing. Nut butters are a safe and effective alternative. This relaxes the arterial walls to reduce resistance to blood flow. If you have found these tips helpful, you now have a set of practical mechanical tools to help manage your blood pressure beyond just taking medication. Remember that consistency is key. These are habits to build into your life, not quick fixes. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.